Anxiety and anxiety disorders. Today, I am going to talk about anxiety, how it is formed, ways to treat it, and how it differs from stress. We will also examine whether we all suffer from anxiety disorders. Through the studies and experiences I have gained in treating anxiety disorders, I have discovered the shortcomings in current studies, the most important of which is the elimination of anxiety reactions and always ignoring the main cause of anxiety and its roots, which makes treatment ineffective and incomplete. The difference between anxiety and stress. The first point I should mention is the difference between stress and anxiety. Stress is a reaction to an external factor. That is, its origin is usually a specific external situation. However, anxiety is an internal phenomenon and often has no clear cause. Anxiety is a natural reaction of the body to be stimulated to do something in the short term, and if this natural reaction is not paid attention to, it may become harmful. However, if its intensity increases or negative and ineffective meanings are attributed to it, it becomes an anxiety disorder. Roots of anxiety and how it forms. To better understand anxiety, we need to examine its roots and understand how it forms. Anxiety stems from fear, and fear ultimately comes back to the issue of death. When the fear of loss or death becomes too intense, the person is constantly on alert. This constant alertness disrupts the person's normal life and reduces their productivity. In mental health, what matters is having proper functioning, which requires calm and meeting basic needs. Some clients ask me if anxiety is right or wrong. The answer is that in psychology, there are no absolute concepts of right and wrong. We are not able to understand the whole truth of the world, and this limitation sometimes causes fear. If we are unable to understand some truths, it is better to calm ourselves with some kind of conscious lie to prevent excessive anxiety. How to deal with anxiety-provoking facts when we are faced with a stressful truth or situation. Our goal should not only be to discover the truth, but we should also consider our mental capacity and strength. But we should seek the truth as much as we can. When we are calm, we can gradually face anxiety-provoking facts. Preventing anxiety and anxiety disorders. There are two key points in preventing anxiety. 1. Understanding the meaning of death. We cannot escape the concept of death, but we must learn from childhood to make sense of it. In adulthood, it is also necessary to think about death and find logical responses to it. 2. Trying within our capabilities. Excessive pressure on ourselves can increase anxiety. The more tired we become, the less effective we are and the greater the likelihood of failure. Successive failures weaken self-confidence and lead a person to helplessness and anxiety. Anxiety and anxiety disorder treatment. In the event of anxiety, we must follow several main strategies. 1. Control psychological stress. Many anxious people do not have a clear plan and cannot assess the amount of pressure they put on themselves. To treat anxiety, it is necessary to measure the amount of energy required for each activity and rest if tired. 2. Recognize your psychological abilities. Each person should test themselves in different situations and understand how much stress they can tolerate and how to deal with it. Understanding individual reactions to stress increases self-awareness and better anxiety management. 3. Loving ourselves. As humans, we must know that our greatest duty is to take care of ourselves. And when we put the responsibilities of life or the attention of others on ourselves, anything can happen to us. 4. Understanding the meaning of life. When we do not have a proper understanding of the purpose of life, we seek the satisfaction or approval of others. Having lofty goals in life and understanding the brevity of life makes our lives more peaceful and valuable, and we become less involved in competition and attracting the attention of others. And we spend more time on our inner meaning and personal goals. 5. Planning, foresight, consulting, and examining the future more before doing our work. Most of my anxiety disorder clients were people who first did something and then thought about it and always envisioned the future and the world as very accessible and easy. Summary anxiety is a natural reaction of the body that, if left unchecked, can become a disorder. The most important factors that are effective in reducing anxiety are recognizing the meaning of life, understanding the concept of death, and making efforts by individual capabilities. Also, managing psychological pressures and planning to reduce stress are important strategies for controlling anxiety. I hope that by becoming more aware of your psychological system, you will be able to manage anxiety and improve your quality of life. Thank you for paying attention to this content.